Yes.
Got it.
Hi, beautiful people. I am here with Elissa, who is a birth keeper. Elissa, I'd like you to introduce yourself. Tell us a little bit about your journey and what exactly a birth keeper is.
Hi, thank you so much. Um, so I am a woman, a mother, and like you said, a birth keeper. Um, I haven't really come up with a title, I guess, for the other work that I do with women. But I work with women and yeah, let me see a little bit about myself. I was born and raised in Southern California.
Woo woo.
Ooh, ooh. I'm currently living in McAllister, Oklahoma,
Well, we can talk about that journey, but let's
right?
continue.
For another time. Yeah.
Yeah,
Excuse me.
all good.
And yeah, what else? Well, I am a veteran. I was in the Marine Corps for 5 years as a helicopter mechanic, and then I got out and went to college and became a nurse. And I was a
Mm-hmm.
nurse for 6 years, fully in like Western medicine.
Mm-hmm.
Um, yeah, and then I had my son, and that was kind of the like catalyst to everything in my life changing. I ended up leaving nursing and then yeah, studying to become a birth keeper, and that's how I came to do this work. And a birth keeper is basically a woman. I'm gonna specify a woman because I guess technically a guy could be, but that's a whole nother tangent.
Yeah, and we can get
Yeah,
into that a little bit later. It's something that I do want to discuss with the culture that's going on right now of how women are being gaslit in so many other ways with the culture right now. But continue.
yeah.
We'll get into it because it's definitely a
Yeah,
subject.
we'll talk about the men.
Yeah.
Yeah, but yeah, basically as a birth keeper, what I do is I support women in having a physiological birth is how I best describe it.
Okay.
Um, if you want to get real technical with the terms, free birth is another big buzzword that's out there in the birth world right now, and that's
Mhm.
basically when you birth without a medical provider in attendance. Um,
Mm.
so medical midwives and anyone trained as a midwife really would be considered a medical personnel. So then you're like, okay, well, Elissa was trained as a nurse for 6 years. Is that considered a medical personnel? That really depends on the person because I definitely do not practice at all in any facet of Western medicine. Um, but the knowledge is still in my brain, you know? So it's like, who could say whether or not I would be considered a medical personnel? But basically, as a birth keeper, my real role is just yeah, supporting women in having a physiological birth, which typically happens at home. I don't attend women in the hospital.
Okay, so that's a little different than like let's say like you said a midwife or a doula in the sense that
Yes,
they still have um for lack of better terms, rules and regulations that they have to
exactly.
follow before they could, be like a birth keeper in a sense. In birth keeping, what I'm getting is that you don't have those rules and regulations kind of attached, correct? Is that
Exactly. There
okay?
is nobody telling me what I can and cannot do in a birth. And that is actually what makes the biggest difference. And I'll touch on the fact that like there is midwives who used to be licensed and are no longer licensed. That doesn't necessarily mean that you're going to get the same experience as you would with a birth keeper because most birth keepers are actually trained in true physiological birth
Mm.
and midwifery training over the last, I don't know how many years, has really become medical training. And so
Mm-hmm.
I feel like it would really depend on the woman. And I would be very cautious and caution women that if they are going to hire an unlicensed midwife or a midwife that no longer practices, that they really have a very thorough interview with that woman beforehand to really get the sense of what her beliefs about birth are. Because just because she doesn't carry a license doesn't
Mm-hmm.
mean that she's not going to still act like a licensed midwife.
Right,
Um,
right, because they have they come from that training of, and you do too, let's be honest, in the sense because you were in Western medicine and that whole culture
Oh
of
yeah.
like having to have these specific protocols and I guess in a sense they are still kind of in that mindset and indoctrination in a way.
Yeah.
Whereas birth keeping is a whole new subset, let's say, not a subset, but its own different entity. Is that correct?
Yeah, yeah, it's more, and you'll find women out there who identify themselves as an authentic birth or authentic midwife,
Mm,
meaning that basically they're a birth keeper, but they're putting authentic in that word because of the fact that now the term that I use is medwife, not
okay.
midwife, because it's like they're a medically trained, midwife.
Right.
Whereas traditionally, throughout, the existence of human beings, we did have these wise women that were, the partera, the midwife. What that word used to mean, was just a wise woman who did what I do, which is just there witnessing and basically, yeah, just witnessing women as they were having their babies. Um,
Beautiful. Yeah,
yeah,
and I feel, it in all past cultures and indigenous cultures, especially, I mean, it really did take a village, right? In the sense that like a birth was a whole like gathering, the whole village was on alert, the whole from what I've read and studied is that everybody not was necessarily in the room or but like the whole village prepared for this new soul coming in to their community in a way. So
yeah.
it's interesting how far off course we have gotten here. And I do
Mhm.
want to tap into why you think we've gotten off course. I mean, obviously, not coming from conspiracy or coming from conspiracy, I know why, but maybe a lot of people don't know why we've gotten so far off into this having women are scared, women, and it's due to culture, due to movies, like everything
Mhm.
that you see in
Media.
movies is like
Yes.
hysterics and yelling at the husband and oh my god, it's so scary and you have to have an epidural and it like
Well, and it's
meanwhile,
always almost in the hospital, right? Like you don't
right.
actually see a birth anywhere besides a hospital.
Right, right. So let's talk about that. Let's talk about how we got there. Why all of a sudden, this beautiful process just was overtaken, by this medical industry.
Yeah, I think it really begins or began, at least in my understanding of like way back to witch trials, like this full out um shift in the culture that like it was all when, the whole medicine was beginning as like a practice and it was all men and they basically were like, cool, we got to get rid of the competition, which is all of these wise women in the village that use herbs and, natural remedies to heal people. We have to find a way to make people afraid of them and get rid of that so that we can come in and say, no, we know how to do this and it's better. And of course that's like a very overgeneralized thing about what happened, but that was really, I feel like, the start of it, because then, women were being specifically targeted. And I mean, if you look and do some research into what the definition of a witch was, it was like, oh, seen gathering with other women. It's like, what? Like,
Okay,
really?
yeah.
Okay. Yeah, just because I talked to my friend, you and I having this conversation back then, we could have been,
Or and we're picking
accused of witchcraft.
flowers. Yeah, we're
Yeah,
picking
exactly.
flowers, gathering, lavender or whatever, just because we love it and we're girls and it smells good. You know what I mean? Not
Yeah,
necessarily like
literally. It didn't,
doing
it
anything with
honestly
it.
didn't take much. Yeah.
Right.
And then so then when, medicine began and it was like hospitals and they're trying to get women to believe that they need to come into the hospital. Initially, women were not about it. Like they were like, no way, we're not going. And women were dying. A lot of women were dying because,
In the hospitals.
in the hospitals,
Yeah.
exactly, in childbirth, because you had these doctors, men, all men, um, going in and touching dead bodies and then coming in and delivering a baby and they're not washing their hands. And, like we can get into conspiracy theories about germ theory and all of that. But point being is that, like, yeah, it women were dying and they were afraid to go to the hospital,
Right.
and then with the popularization through like royalty and like it basically slowly but surely it was like the persistence of no, this is better. And then you have like the people in a society that are more well off, it became that, right, where it was like, oh yeah, well, if you go give birth in the hospital, then that means that like you are considered not poor.
Right, you have a higher stature in society, and then
Exactly.
that's when you see, like, in the movies, like, let's say in 1950s, like the men are outside, and looking at their babies in like the little waiting, or what do they call it, the
In the
nursery,
nursery, oh
and
god,
like
yeah.
smoking cigarettes outside, and let's not even talk about how the dad just totally gets cut out of the picture here, can't even be in the birthing. So the baby, the soul that's coming in, has zero connection with the father, during
Hmm.
this whole transition into, the new world, basically. And the mother has zero control over herself, because now they're pumping, because of the medicines, that whole
Hmm.
of how it started, with the oil, um and anyways, they needed to use the stuff, and that's why they created medicines, that's how this whole thing started. But how everything just got, oh well, you need a medicine for this and you need a medicine for that, and it's just like, when women have been giving birth naturally for eons, so it's just,
Exactly.
it's crazy,
Yeah.
how good the propaganda was to
Right.
and like you said, because you were going to a hospital, that meant that you were like better off, than other people. It was like um animalistic to have, like, a birth at
Right.
home, like a savage, like back in the day, like what they used to call people, like natural people.
Exactly. And that's the thing is like, this is not just, it's like everything is intertwined, right? It wasn't just like,
One
oh,
thing, yeah.
medicine. It was like, we are attacking everything that is natural and labeling it as bad, as scary, as primitive, as all of these things. And so it's like, it's all interconnected, right?
Yeah.
Where it's like, yeah, no, you have to go to a doctor. You couldn't possibly know what's going on with your own body. And yeah, we have all these medicines. And there was this um assumption that you could even make a connection back to religion about how
Yeah.
women, there's that whole thing, supposedly, I don't even know what religion it is, but about how like labor and the pain was actually God's punishment over women because of Eve and blah blah blah. And
It's
that's a
so sick and demented. I mean, I can't. I mean,
it's
I've
a
heard,
whole podcast unto itself talking about that.
oh yeah, for sure. And I just, I hear stories of, like, some women, I had an old colleague of mine, she said, oh, I loved every minute of being pregnant. And like when she gave birth, it was like ecstasy, like having
Yeah.
like a transcendental experience. Of course, there's pain and blah, blah, blah. She didn't say it was all roses, but like that completely changed her life, like, and I've heard numerous accounts of that, not just, of course, there's the pain, everybody has, you can't have it without the pain, right? You can't have a baby
I
without,
mean, there's definitely women out there, especially now that like birth is coming really back into the forefront, at least in my universe,
yeah, in your field,
that
of
are
course.
talking about that, yeah, that like ecstatic birth is possible and that it doesn't have to be painful. And in my perspective, it's like, yeah, what exactly is pain, right? Like, is it really
Right.
that it's painful, or is that it's an intensity? Is that pain really coming from the sensation of your body, or is it coming from your mind
Mind,
and the
yeah.
fear? Like, because I've heard women talk about like cervical orgasms and say
Hmm.
that like at first when they were having penetration, that it was feeling very painful, but then through their mind and deciding that, like, is it painful, or can I just fully surrender to what is happening here and let go, and that in an instant it will shift from pain into pleasure. So to
Mhm.
my mind, it's like it's the same thing when it comes to the birth process. It's like, if you're afraid of it, if you're fighting it, if
Right.
you're expecting it to be painful, then that is what you're going to feel. But it's possible to really actually truly surrender and not fight it and
Right.
experience complete ecstasy. And I mean, it's like variations of everything in between that, right? Like
Yeah.
sometimes the pain is necessary, I feel, because birth is a transformation. No matter what happens, you're not the same person afterwards, right? You're not the
Right.
same woman. And I feel like sometimes, the body is wise, and women, perhaps like the woman that you mentioned, like they needed to feel that pain and survive it so that they could be transformed and know that they have this power and be like, I did that. Like,
I got
listen,
this. Yeah. Life is like,
I exactly. I could
yeah.
do anything. If I
Now
could do that, I could
she's
do anything.
right. She's still supporting her like 27-year-old daughter, but that's a whole different story.
Oh yeah. Yeah. I mean, the
Which
landscape of
there's
this,
no judgment on that, but it is what it is. But I
yeah.
just found her story very interesting. She's like, no, it was like ecstatic, and like I just loved being pregnant. Like I felt so alive, and like some women just feel that way, and I think it's just that probably a lot of women feel that way. Is just we've been shown a completely different story. So, we all have been programmed that, like, oh God, it's just like, oh, you're big, you're sweating, your feet hurt, blah, blah. And not to say that that's not true, but
Yeah.
it's like always the negative side that we're shown versus like the positive, right?
Well, and it's become so pervasive that there's almost this like this tendency of women, if they are enjoying their pregnancy, if they did have an amazing birth, that they feel shame, that they feel like they can't
Mm.
say that they did, because then that gets twisted into, oh well, you were just lucky, you know
Right.
and it's
Yeah.
like immediately they're gaslit, or like put down or looked down upon for having a good experience, because it's like so many women are so traumatized by their birth, and they're not even conscious of how traumatized they are, right? Like these are the women that go around and they see a pregnant woman and they just immediately tell her their traumatic story, and it's
Right.
like, what is that? That is such a huge pet peeve of mine. Like, how dare you? Who are you to put your trauma on someone else? And just like, she's pregnant. She is carrying life. Like,
Yeah.
that is not the person that you go and dump on when you have trauma.
Right. Yeah. And like keep your story to yourself. Like you don't want to imprint that into like a pregnant lady's mind. You know what I mean? Who's already
Right.
super hormonal, probably all kinds of things are going on. And you just don't know.
Well,
Um,
and spiritually and energetically, pregnant women are much more open.
right.
They're much more sensitive to that stuff. So it's like, you say that to a person, a woman who's not pregnant, it will affect them differently than a woman who is pregnant. And the further along that she's in her pregnancy, like my recommendation is always to women, when you hit your third trimester, you freaking go in your cocoon. Like, you turn off your phone, do not talk to anybody that you don't know for sure is going to come in with love and full support and zero fear. Because
Interesting. Okay.
that third trimester, it's like the veil is thinning, between this world and the spiritual world. And it's like, women are much more susceptible to fear being implanted the closer that they get to
Mm.
their baby emerging. Yeah.
Beautiful, beautiful. So, since we're on the topic, I'd like for you, if you're okay with it, to share your story of your birth in the hospital, because I know it wasn't ideal, and I feel like a lot of women have a plan, right? You have a plan, you have a set way. Of course, nothing ever goes the way it's planned, but there's certain things that you definitely want for yourself. And I want to touch a little bit on how that just completely gets pushed to the side when you're in a hospital setting, if you wouldn't mind sharing your story with us.
Yeah, of course. Thank you. And I think the part that I feel is so important about sharing my story specifically is like how it is that I came to be in the hospital in the first place,
Mm,
how much that was not like I was adamant and would not even discuss the possibility with my partner at the time of going to the hospital. It was like that's not going to happen, and I was literally um I'm trying to think of the word for it, but like my unwillingness to even discuss it as a possibility um was me avoiding the actual like reality of what that would be,
mm,
so it was
mhm,
like then that basically left it to where the minute that I was in that hospital, then I was just completely outside my body. But how that even started was before I even got pregnant. A friend of my son's father was we were randomly at a friend's house, and she just started telling us about her free birth basically that she had had with her second child recently. And no, I don't think we asked her anything. It was just like a spontaneous, she just was wanted to share. And I was floored. I was like, oh my God, yes, I'm gonna do that. That's amazing. Like, she was even talking about, I'll never forget. She's like, yeah, it was like 3 days after the birth. And I was just like, oh, I guess I should like, take him to the hospital and like let people know that he even exists.
mm. So it
And it
like
was
really
just,
resonated with you though, like the
oh
free
yeah,
portion of just like that must have been nice for her of like just having those 3 days of like me and my baby or and the partner,
yeah.
hopefully.
Oh
Um,
yeah.
you know,
I think it's like a cellular remembering, right? Like this is how babies have come into the world
right.
since time began. And so it was just like, yes, like that's how it's supposed to be. That's what I want. And then who I was at the time was like, oh well, he is the father of this child, so he gets a say. And that is a big no-no in my opinion. And that was the lesson that I learned the hard way,
Mm,
is that it's your body, it's your baby, and you have the final say over what happens to your body and your baby, and you should not give anyone else um authority over you.
okay.
And so unfortunately who I was at the time, like I said, I did, and I told him that that was what I wanted, and he said very explicitly, fuck no.
Oh wow.
And that was it. And it was like, no, not going to happen. And I was like, well, I'm not going to go to the hospital. So what was the compromise, which is something I also don't, I hate that word.
I know.
Um, because compromise is not, it's one person getting what they want and one person not getting what they want, like you can actually have the existence of win-win situations for all if you're willing to be creative. But anyway, yeah, so the compromise was a birth center, right? And at the time, I really believed that that was a like viable option. I was like, I would joke and say, yeah, like I just don't want to have the mess at my house, so we're gonna just make a mess at the birth center and have them clean it up. And it was like, ha ha ha, it's gonna be so funny, right? And basically what happened was I thought that my water had broken. I
Mm-hmm.
had never heard of a leak. I didn't know that you could just have fluid leaking and that not actually be your water breaking.
Right.
I
And
didn't feel
how
any.
far along were you? Like, were you at the point like ready to
Oh, this was,
pop?
yeah. So
Yeah.
this was
Okay.
midnight into my quote unquote due date that they gave
Okay.
me.
Got it. Got it.
Um, I can talk about due dates later too. But yeah, midnight going into my quote unquote due date, I started feeling some like wetness, and I got up and I was like, oh. And basically it was my fluids leaking, and then I like went back to bed, and then it started again, and I was up and back to the bathroom like every 2 minutes for like 30 minutes straight, and I was like, okay, like maybe this is my water broke, like this is why this is happening. But again, I didn't have like a big gush. It
Right.
wasn't like whatever, it was literally just a leak. And so theoretically, I probably could have been pregnant for another 2 to 3 weeks. Who knows? Because
Right.
amniotic fluid is constantly replenishing, you know? So the leak could have closed spontaneously and I could have stayed pregnant. Or it could have just continued to leak and it would have been no big deal.
Right.
Because I was having no sensations, just the leak. But because I was again going through the birth center and they give you a whole printout of rules and call the midwife when you know this and this, if you're a first time mom, wait until your sensations are within this many minutes apart or whatever. But outside of that was like the caveat of if your water breaks, you need to call immediately. Um, but I was so excited and just like, oh my God, like it's happening. Like I've wanted to be a mom my whole life that there was like 2 hours that passed before I was like, oh crap, I was supposed to call the midwives. So I called midwives, right? Because at a birth center, you have multiple midwives that are working there. And the midwife that I had been seeing at all of my prenatal appointments was not the midwife that was on call. So when I called, I spoke to a woman that I had not really interacted with at all. She was actually at another birth. So she was distracted while she was talking to me and basically instructed me to start taking my temperature every 2 hours and to call them back if I had a fever.
Okay.
So immediately from here, it's like this is where it already is going downhill, right?
Hmm.
Because I'm
Hmm.
not having any sensations, but I told her that my water broke. She didn't ask me any questions about that. She didn't say, well, was it a gush? Are you just having a leak? Nothing. She just was like, oh, first time mom. Okay, your water broke. Cool. Take your temperature every 2 hours. Why?
Right.
Because
Okay.
just because your waters are open, now you're at a risk of infection, is what they believe, which, unless I'm like sticking anything dirty up in my vagina, like there's no reason why I would have an infection. Just
Right.
because your waters are open does not mean that just that alone makes you higher risk for infection, right? But again, she's distracted. So this is what she tells me. I started taking my temperature. Of course, it's like fine. But now I'm focused on that and still not having any sensations. Basically, long story short, is that I was put on a clock of 24 hours after my waters opened before I had to go to the hospital. If I was not in active labor within 24 hours, then I would have to go to the hospital. So pretty much I spent the rest of the day doing everything that I could to try to like make my baby come out, even though he was not actually ready because my body was not having any sensations. I was not actually in labor. So
Wow.
now I was trying to make labor happen because of this.
Time
I'm
clock. Yeah.
right.
That they
Like,
gave
I don't
you.
want to go to the hospital. So
Right.
that included going in to see the midwives later on in the day and them asking, doing an ultrasound, which was something that I had not wanted throughout my pregnancy. I only had one ultrasound at 20 weeks, the anatomy scan or whatever.
That's the one
Um,
that tells you like if there's any defects or stuff like
right.
that. Okay.
Yeah,
Got
they're
it.
mostly looking for severe birth defects. Um, but yeah, she was like, we need to do an ultrasound to see if he's head down. It's like you can't palpate. You can't.
Yeah.
How
Like,
did people do this before
I mean, I
technology?
thought they like, I thought it was like, don't they like put their hand in your vagina and like check? I mean, isn't that like midwives were known to kind of like do that, right? Am I crazy? I mean, I've heard of that. You can like feel your
Traditionally, I
belly.
do not think that women were putting their hands inside of other women's vaginas. No. I
Really?
think
Okay.
that the medical procedures is where that whole sticking your hands inside of women started.
I mean, I thought they like
Traditionally,
felt the bellies and to
yes,
see
yes.
it,
So
how they
that's
were
palpation.
positioned.
Yes.
Yeah.
You
And
would
then like
feel the
kind of,
belly,
yeah. And
and
then,
move it around and also
okay,
ask the mom because hello, it's her body. Like
you can
she should
tell.
know
Yeah,
and
you
she
should
can
know.
tell. Exactly. Yeah. She can tell you where she's been feeling movements, etc. Um, so anyway, yeah, so they did a quick ultrasound to check that he's head down, which caveat it doesn't matter if he was head down or not because breech birth is not a problem, right?
Right.
Um, but in the hospital setting, it is. It's an immediate C-section in most states, you
Great.
know, like yeah. So luckily for me, he was head down. And then they did a membrane sweep, which that sounds like no big deal, right?
I mean, it sounds pretty fucking scary. I don't know, but
Yeah, basically it's the midwife sticking her fingers inside of your vagina and then trying to scrape her fingers in between your uterine wall and the freaking amniotic sac to
okay.
try to
See, that's what I
encourage
thought that they did to check, not that, like
ovulation.
the membrane, but like they felt like they went up and felt like if the head was there and stuff like that, along with feeling your belly and like, doing all of that. But
Yeah.
I didn't know that there was like a membrane sweep. That sounds really weird.
It was so painful. It
Oh,
was
wow.
incredibly painful and it's incredibly dangerous. That's the
Oh,
thing is that they didn't tell me the risks. All they said was, okay, well, if we want to get your labor started, then we can do a membrane sweep, and it's like I'm not even gonna name off all the risks, like people can look that up, but basically it's like this is the big thing that I have against midwives and against doctors is that like they don't informed consent is not a real thing.
yeah.
It's a joke.
Obviously, we saw that the last 3 years.
Exactly. Yeah, exactly. It's a joke. And
Yeah,
it
it's
always
a
has
fucking
been,
joke.
especially in the realm of labor and delivery,
Right.
right? So in while she was doing a memory sweep, she didn't tell me that she was going to do this, but she also decided to stretch out my cervix. So like stick her fingers in my cervix and like just push her fingers out to try to stretch it out to make it open.
Mm,
Yeah, didn't tell me that she was going to do that, and she did it, which of course at the time I didn't care because all I cared about was not going to the hospital. So it
right.
was like all of my why I didn't want to go to the hospital, which was to have a natural birth. It was like this dissociation that happened in my brain where it was like, as long as I'm not at the hospital, then it's okay. But it's like,
Mhm.
no, I was already completely sabotaging this birth with all of these interventions, right?
Right.
So then after that, they send me home with castor oil. Ugh. Basically, castor oil, if you're not familiar, is the like thickest oil I think I've ever seen.
Yeah, it's very
And
thick. I actually do it for my liver. Like I put it on my liver at night just
yes,
to
it is
detox.
great.
Yeah.
Yes, castor oil packs are amazing. Castor oil in itself is amazing, but to ingest it orally, I is very dangerous because
Wow.
it causes contractions of your soft tissue or your soft muscles, or I'm probably saying that wrong, but basically your intestines and your uterus are part of the kind of muscle that it has an effect on,
Right. And
right?
castor oil is said to like if you're like constipated for a long time, that's the stuff that makes you like go poo. Right?
Yes. Yes,
Okay.
exactly. So
So
basically they
your pain was probably poo pains, it's crazy.
yeah. Well, and that's the thing is like, yeah. Anyway, so I go home. They say to take 2 ounce, drink 2 ounces first, and
Two
then wait.
ounces. Oh my
Girl,
God.
I drank 4 ounces total.
Oh my
Okay,
God. Uh-huh.
it's gross. I don't know how I did that. Um, unfortunately, that's where the Marine Corps training came in, but not in a good way.
Right.
Anyway, yeah. So drink the castor oil. It doesn't do anything because again, my body's not actually ready to have this baby yet. And then I drink the other 2 ounces a few hours later, and then finally around like 5, 6 p.m., I'm starting to have some intermittent sensations,
Right.
right?
Cramps.
So now I'm going to the walking to the park down the street and walking around the park vigorously and basically exhausting myself trying to get this baby to come out. Um, and yeah, shockingly, I was not in active labor when midnight rolled around, So by 10 p.m., I was scheduled to go back to the midwives, to the birth center. And basically, it was just kind of like this awkward vibe where it's like now I'm very intuitive about vibes and I'm able to pay attention to that, right? But back then it was like I was again, so just like, this isn't happening. I'm not going to the hospital. And
Right.
everybody in the room is just like, so yeah, how long are we going to wait before we tell her that she's going to the hospital? You know,
Oh shit.
like
Yeah.
if she's not in active labor. And like the midwives that were there, again, completely different than the one I spoke to this morning, and also not the same one that I had been seeing my entire pregnancy. So I don't know these women, they're strangers to me. And um, yeah, basically I end up at the hospital is what
Mm.
happens. And I remember one of the midwives telling me, you know, I know that you don't want any drugs, but you know, you might need to get the epidural. You should just be open to that because if you're too exhausted, it will give you the opportunity to rest, was what she said to me.
Yeah, which a lot of
So
people don't understand that it actually a lot of times prolongs the birth because you're not feeling jack shit.
exactly. And what they don't tell you is that your baby gets those drugs, right? So
Right.
they talk shit about mothers who come in who are on drugs, but they routinely give freaking infants in
In
labor
utero, yeah.
narcotics. Like what the
Oh my God.
and then when the baby comes out and they're having problems breathing, they're like, oh man, it's the baby's fault. Yeah, it's the mom's fault. Yeah, it's not our fault. We didn't give that baby drugs, right? Anyway, so yeah, so then now I'm driving the 2-minute drive to the hospital and I completely leave my body. I'm just at this point, I'm like, this isn't happening. I'm somewhere else. Um, and yeah, the long and short of it is that I ended up getting Pitocin, which I consider to be a torture drug. Um, because basically what it does is it's the synthetic version of oxytocin, which oxytocin is like endorphin high when you go for a run, right? You feel really good afterwards. Like that's what oxytocin makes you feel. Pitocin does the physical things that oxytocin does in your body, but you don't get that I feel really good part of it.
Mm-hmm.
And then now your actual endogenous oxytocin cannot get into those receptors because now they're all plugged up by the synthetic version. So now
Mm.
you don't feel good.
Yeah.
You just get the shit part. Speaking of shit, yeah, early on when they had like, I don't even think they had started Pitocin yet. And I was like, I have to go number two, you know, I
Right.
was like, I'm already hooked up to an IV. So I'm already like confined to the bed, right? Technically, I can get up and move around, but I have an IV in this hand that's strapping me to this side. I have the monitors that are strapped to this side. So it's like,
Oh,
where am I really going? Right.
yeah.
And they're like, oh, you feel like you have to poop? I hired a doula, by the way. My
Mm-hmm.
doula's like, she's like, oh no, sweetie. She's like, that's probably the baby's head coming down.
From your butthole, like, I mean,
Right.
you
I was
can
like,
tell when you
listen,
want to shit. I'm sorry.
yeah, I was like, I'm sorry, but this is not the baby. Like, I'm not in active labor still. That's dumb. And I was
Crazy.
like, no, it's not. So luckily, no, because again, nobody is listening to me. The nurse was not even there.
Oh.
Like the night nurse that I had, she was brand new, so she was not in the room. Um, and luckily I was a nurse, so I knew how to take my IV out of the pump, and I just unhooked it, grabbed the bag, threw it over one shoulder, unhooked the freaking cords from the machine, threw them over the other shoulder, and then I went to the bathroom and I took my shit. And that castor oil, that's all the castor oil did was make me basically shit my brains out for the rest of the next day,
Right.
which was not that big of a deal, right? At that time in the beginning. But then once I had that epidural later, now I'm basically shitting myself, and this nurse has to come and clean me up every 30 minutes to an hour, and I
Oh
can't help it.
God.
It was so embarrassing. And so like, because of course there's a room full of people. My mom's there, my husband at the time is there, my doula's there, the nurse is coming in, you know, it was just like, oh, sure. Look at all these people watching me shit myself in this bed. So anyway, when the day shift nurse came on, basically she was much more experienced. She got Pitocin going very quickly, which yeah, it definitely started my quote unquote labor, but to the point where my contractions were like on top of one another.
Mm-hmm.
And that's why I call it a torture drug, because that's not how labor would normally progress. Your body doesn't do that to you.
Right.
When they are on top of each other like that, you usually, even if they're like back to back, there is a break. Even if it doesn't feel like it's very long, you come down and then it comes back up. This was literally, there is no break. Just, I'm getting freaking pummeled by these contractions. And my son was sunny side up, as they say, or OP
Which
position,
means
whatever you
what?
want to say, which means that basically he was turned with his face towards the back of me. And usually the
Okay, I
babies
see.
are turned the other way.
Got it.
So when he came out,
He was
his face,
backwards. Yeah.
yeah, his face
Yeah.
was facing up. And normally the baby is facing down.
Oh, I see. Okay.
So what that does is it puts all the pressure on your lower back versus in your like front of your pelvis.
Right. And I'm
And
sure it can't be like all that great for the baby either, right?
I mean, it's fine. It's
Oh
not that
yeah,
it's a
okay.
problem, but in the context of getting Pitocin, yeah, it's a problem because again, he's also getting these contractions that are
Right.
not meant to be like that. So his heart rate is going crazy and being like, what the
Oh,
hell is
that's
going on?
awful to think about that, like the baby is like, what is going on here,
Yeah,
Oh,
exactly. They just like I literally felt like I was gonna die. I was like, I cannot do this. And mind you, my husband at the time was the only person in that room that was strong enough to give me any kind of counter pressure on my lower back so that
right.
I could find any kind of relief. But basically, once it got to that point, it was like it didn't matter. I was like, give me the epidural. Like I
See,
have to
this is
have
what
it.
happens.
Exactly.
You don't want
Cascade of
it. They,
interventions.
yeah, it's like step by step, they kind of in their own little maniacal way
Yep.
push you into getting shit you don't want.
And the first step is that IV. And they
Right.
tell you when you come in that you have to have an IV because of an emergency, they need to give you drugs, they need to have access to it. But what happens is a lot of times women will start getting, the nurse will turn on Pitocin and not even say anything to that woman. And
Oh
she'll
my
have it so
God.
low because the nurse will talk to the doctor and be like, this is taking too long. We're going to put her on Pitocin. Don't say anything to the woman and just start Pitocin. And that's the thing is like now they have access to your veins. If I could push a medication, a nurse can push a medication into your vein very quickly without you realizing it. You know what I mean? So
Shit.
it's like
That's
that
so
that's where
scary.
it starts. Yeah.
Yeah. So scary.
And I mean, I had a bunch of other interventions too. Like when I came in, of course, they didn't believe me that my water had broken. So they had to do a test. Then they had to do another ultrasound. Then they had to do this and that. And then, oh, my waters were too low. What does that even mean? Ultrasound is completely um, inaccurate, especially when it comes to measuring fluid levels. And like I said earlier, your fluid levels are constantly replenishing. So if my levels were low, they should have just given me um, hydration and left
Hydration.
me
Yeah.
alone.
Like, yeah, exactly.
But no,
Common
instead, they
sense to me. I mean, I don't even know any of this, but common sense to me is like, okay, well, your levels are low, so you need a little bit of hydration, maybe a little salt, maybe a
yeah.
little something, more water or like Pedialyte type stuff, to help you with that. It's just, I
But
don't
in
know.
their logic was we're gonna stick something up into your through your vagina into your uterus and
Jeez.
push fluids that way.
Oh my God.
Yeah. So now I had to stay in the bed because now I have this freaking thing in between my legs, and now I can't move around or else it's gonna fall out. And then because they're doing all of this stuff and they have Pitocin and I'm moving around trying to like even deal with these contractions, oh well, we can't keep an eye on him on the monitor. So we need to do internal monitoring,
Oh my God.
which again sounds benign, but they don't tell you it's a little metal screw that they literally screw into your child's skull so that they can monitor their vital signs.
Jesus. I mean, I'm can't imagine like being in that position and like the level of stress that you're going through, and that is feeding into the level of stress the baby is getting.
Yeah.
I mean,
Everybody in the room was stressed.
yeah, it's just
My
so
ex talks about all the time
inhumane.
about how, well, he doesn't talk about all the time, but he told me about how like traumatic it was for him to listen to the heart rate
Yeah,
going down and going up and going down and going up. And like, of course, he didn't really understand that like that actually normally is what happens in birth.
right.
You know, it's okay for the heart to decel,
Yeah.
but it usually comes right back up. And yeah, all he kept hearing was, you know, focusing on the on our son's heart rate.
And that's a lot of
So
things that we don't talk about, of how also men get so gaslit in the situation too. The
yeah,
father basically has no fucking say. And that was, well, I want to finish your birth story, but I want to get into that as well. Like, how can we empower the fathers to like be a united force with the women in terms of like, we saw obviously in the last 3 years how much people believe in Western medicine or the media, and like, just they have like faith in these institutions. And it's like, how I want to know how we can empower fathers or partners, whatever the situation is, into having um being that like rock when the woman is like being manhandled, for lack of better terms of words, being
yeah,
strong armed into
it's
like
accurate.
trying to get, yeah, there you go, that's the word, into getting all of these procedures. How can I want to get into how men can get more involved into this as well and know, because I think we cater so much to the moms that we leave the men out of the conversation. But let's get into that. And I do want to finish the birth story, because I find it so fascinating.
Yeah. So basically at this point, when I'm getting the epidural, I honestly don't remember if the internal monitoring was before or after, but I'm pretty sure it was before because once I got the epidural, it didn't work at first, of course. Like they had me like turning over this side to that side to try to get it because it was like working on one side and not on the other side. And it was still so painful. I was like, doesn't feel like it's doing anything. But eventually it did work, right? And what the midwife said about you're so exhausted that you need the rest, literally that's what happened to me is I took a 4 hour nap and I just went to sleep. And I don't know if they turned down the Pitocin. I have no idea what was happening because I was just literally dead to the world.
Yeah,
Um,
basically they can do anything to you while you're sleeping, in terms of like
yeah,
pumping you up, pumping you, whatever.
exactly. Yeah. But yeah, I slept through everything at that point. And of course, my husband at the time got his break too. He was knocked out without any epidural because he was so exhausted from pushing on my back so hard. And I mean, he was pushing so hard that he was like, I really feel like I'm gonna hurt you. And I was like, I don't care. You're not pushing hard enough. Like push harder.
Right.
But the next day, I literally felt like I got hit by a truck. I had
Ooh,
bruises, like
yeah.
it was bad. Um, but so anyway, yeah, I wake up from my nap and the nurse came in and she's like, oh, like it's been a while, like we should do a vaginal exam. And for the most part, they had not been doing vaginal exams on me because my waters were open. So they were like, which again, this doesn't make any sense now talking about it, because it's like they're not doing vaginal exams because they don't want to stick their hands up there, but they're sticking all this other stuff up my vagina, right? The internal monitor, the freaking putting fluids up there. It's like, make it make sense.
The
Anyway,
logic is so fucking stupid. It's so, I mean, I just like common sense is just out the fucking door. I
yeah,
don't get it.
yeah.
I don't get it.
So, and mind you, because of the castor oil, like I'm shitting constantly.
No,
So
I
now
know.
there's like,
I trust me. I know about the
right?
castor
It's like
oil.
now
Yeah.
there's
You probably were cramping because of the castor oil because you like had to take shit. It's
yeah,
crazy.
exactly. So anyway, she does the vaginal exam and she's like, "Oh, you're at 10 centimeters. Like, hooray!"
That's pretty big, right? That's like when you're ready to give
That's
birth,
supposedly, yes, that is
right?
supposedly like the fullest dilation. Now, again, I believe personally, from what I know about physiological birth, you don't have to get to 10 centimeters depending on
Right.
how big that baby is. And
Sure.
some babies may dilate that cervix to bigger than 10 centimeters. But in the medical world, 10 centimeters is the goal, is the like, you did it. You won the prize. Now the baby can come out because you reached 10 centimeters. So basically her vibe when she came in to do the exam was very calm, very like, hi, because I had just woken up. I'm like groggy.
Suspect.
The minute she had her 10 centimeters, it was like, oh, Energizer Bunny. She's running around the room, getting everything ready, like, yeah, we're gonna have this baby now. And getting the little table ready, getting me into stirrups because hello, we don't want to wait, right? They couldn't possibly wait to turn the epidural off to give me actual feeling in my legs. It was like, no, no, no. You're at 10 centimeters. We have to have this baby now. Like, what's going to happen if you wait? Nothing. Nothing's going to happen if you wait. But they didn't wait. So now they have me in stirrups, and we had not found out the sex of our baby.
Mm-hmm.
Right? Which
I
everybody
love
that
that.
knew us, thank you. Everybody that knew us knew that, the doula, my mom. And it was, I think, even on our little board thing that was in our room. But once I was like in the stirrups and all ready to go, because this is a teaching hospital, yay. Basically, this crowd of like 15 people, residents, doctors, I don't know, nobody introduced themselves, comes in while I'm on full display and are like, basically position themselves at my vagina to be like, yeah, we're gonna watch her have this baby.
Oh my God. And you're not even allowed to give consent to any of this bullshit?
They didn't ask me, they
Oh
just came
my
in.
God.
And again, not only did they not ask me, they also didn't even tell me who they were. They didn't, they was men and women, like, and at
Students,
this point,
basically.
again, exactly. And at this point, I'm still hopped up on drugs. So I don't even care. I'm like,
Right,
sure,
whatever.
whatever,
Yeah.
like, and that's what they want. That's what they want,
Yeah.
is that you don't care. So anyway, they come in, they start coaching me to push. I can't feel from the waist down.
Yeah,
So
of
how am I
course.
supposed to feel what's happening? I'm basically just like, like, I don't know. And they're like, no, not like that. You're doing it wrong, like infantilizing me. And I'm like, again, this doesn't make any sense.
Motherfuckers.
This does
Yeah.
not make any sense. Anyway, eventually he did come out. They had to use a vacuum on his head
Oh,
to help pull him out. Yeah. Because the like internal monitor wasn't enough trauma on his little brain and his little head, right? Like now they have to put a vacuum suction thing to pull him out. Um, and then yeah, he came out and there was like this awkward silence when he emerged because I was waiting again in my drugged up, stooped up state for them to tell me whether I had a boy or a girl. And they were waiting for me to like be excited and be like, yay, oh my God, my baby's here, or whatever. And so then there was like they brought him up to my belly, which he like pooped on my leg on the way up. And then so he's on my belly and they're like, there's just like this awkward, silence. And then my doula's in one of the nurses' ear being like, they don't know the sex of the baby. Huh? They don't know the sex of the baby. Oh, it's a boy. Oh, and then now we're all excited or whatever. But it was like so dumb. I was like, this is exactly like this awkward moment is because you people don't know me. You don't know anything about me.
right.
And yeah, anyway.
So impersonal and so
Yeah.
how it's just not supposed to be, I think. And I don't know. I mean,
Yeah.
I have
Well,
known
and
like
then
one woman who's gone to the hospital and been like, oh, the greatest experience in my life. Not one. So, I
yeah,
mean, I'm sure they're out
unfortunately.
there. I'm
Oh
sure they're
yeah,
out there.
because there's women who go to the hospital when they're already in active labor
In
and then they
labor.
end
Yeah.
up having the baby before, like they do quote unquote get lucky. I don't think it's luck, but where it's like the hospital doesn't even have time to start all their bullshit before that baby's like, okay, we got to get out right now. And then
Yeah.
the baby comes out and they're like, oh my God, it was amazing. It's like, yes, it happened at the hospital, but like it was not because of the hospital. I mean, I guess
Yeah.
anyway, you can argue that it is, but anyway, yeah, I had a tear. because again, coach pushing, I can't feel what I'm doing.
You're getting vacuumed out,
Yeah, he's
not
getting vacuumed
natural.
out.
Yeah.
None of this is the way it's supposed to be. So then they stitch me up, which I still have a protrusion in my vaginal canal of
Oh,
tissue
no.
because you're not supposed to stitch tissue when it's swollen.
Right.
But again, in labor and delivery, they do whatever they want. And so it's actually very routine that they will stitch women immediately after birth. And I don't believe that tears ever really need to be stitched. Um, the only place that you can get a 4th-degree tear, which would actually require stitching, is if you go to the hospital because
Right.
of all of this shit, right? Like then you
Yeah.
might end up with a 4th-degree tear.
Yeah,
But it's like,
I know even like my mom, she jokes around, we speak Spanish. So me rompiste el culo, she's like, she says that, but I know that, even though it was like a vaginal birth, like I don't think she ever got like stitched up, it kind of just like healed up naturally and all of
and
that.
it will.
Yeah,
It
you
will.
didn't,
Because that's what it's made for.
yeah, of course, they didn't do that back in the day in the 70s in Nicaragua. I mean, that did not happen.
Yeah.
So, but I know definitely it was like a hospital birth, but yeah, I don't think they did stitch her up or anything like that. I think it was just a natural healing,
Yeah.
So
Yeah.
it's crazy.
Yeah. And so basically that is the chaos that was my birth story.
You know what,
Um,
Elissa, and I think that like, not to downplay your story or anything like that, but I fear that it's not a fear. That's the wrong word to say, but I just feel that like so many women have this story, in one iteration or another, but basically that whole trauma experience of just, getting gaslit, getting drugged up without consenting, doing things that you don't want to be done that's not part of your birth plan. And I get it, stuff happens. Sometimes you got to go to the hospital. It is what it is. There's complications, all of that. um but I want to know like what women can do, and men for that matter of fact, of how they can stand their ground and what things that they can say, to battle. And I hate saying the word battle, but to actually stand their ground with doctors and hospitals to not, get these procedures that they don't want.
yeah. Well, the short answer is stay home. Don't
Yeah.
go.
I mean,
Right?
look, you're talking to somebody who would probably, if I were ever lucky enough at this point, which I'm 45, I don't know if maybe that ship has sailed, but um, that would be my, choice. But for a lot of women, maybe that's, they're still not in that
Yeah.
boat yet,
Yeah. And I will say, I'm going to just say that I'm obviously very biased against the hospital, right?
Yeah, yeah, of course.
Especially having been a nurse, because my trauma with the hospital and birth actually goes back to nursing school. The first time that
And
I
that,
witnessed,
I think that's important to like a very important distinction coming from somebody who was a nurse.
yeah, like when
Very.
I saw a C-section for the first time, I was mortified. Like it was the most horrific thing I have ever witnessed in my life. I was like, what is this? And it was not an emergency C-section, although they call them that when
They
they're
call
really
all of
not.
them, right? Most of them.
Yeah. I mean, I think some places do have elective ones, especially for like if you've had a C-section before, then you can elect to have it for your next one.
Right.
But yeah, no, the majority of C-sections that are labeled emergency C-sections are not. And
Yeah.
the way you can tell that it's not is because when they say you're going to have a C-section because your label is not progressing or whatever other bullshit excuse that they're using, it's like if they're not running you on that gurney into the OR, it's not an emergency.
Right.
If they tell you you're going to have a C-section and then you don't actually get onto that table for another couple hours, which is majority of the time what happens, it was not an emergency. That's not an emergency.
Right.
Like
Yeah.
if you come into the ER and you got shot, they're not going to wait a couple hours to do surgery on you because it's
Yeah.
an emergency. You go straight in,
Yeah,
like
100%. I mean, that's like the definition of emergency, right?
exactly, right? But like again, there's this dissociation that happens in
Yeah.
labor and delivery where people are like, "Yeah, I had an emergency C-section." And I'm like, "You did? What happened?" And then they tell me, "Yeah, my labor wasn't progressing, and so then I had to have the C-section." And I'm like, "That's not an emergency.
Right.
Your baby just wasn't ready to be born and they didn't want to wait. So they decided to give you major abdominal surgery." Like
Ugh.
that's the reality of what happened to you.
Yeah.
Um so your question was about what people can do, right? If they're
Yeah.
really not ready to not go to the hospital. And
Do
my
home birthing. Yeah.
biggest, yeah, is just educate yourself about physiological birth. Honestly, like what does actually that look like? What does like I have a free ebook, I think, on my website. I don't know if it's listed on there or you can message me or whatever to get it, but I wrote it about the like hormonal matrix, what's happening with your hormones during the birth process and how that all needs to like it's like building blocks. Like all of these things need to be in place so that all of this can happen the way that it's supposed to happen and then your birth will progress the way that it's supposed to,
Right.
right? Which is what happens when you have a woman like your friend that you mentioned that like she comes out of it a changed woman in the best way possible,
Hmm.
where she's like, I freaking did that. Like, um, yeah, education, education, education. And the thing is that you really need to understand that the hospital is a battleground. It
Hmm.
is going to be the battle of the wits. And you're going to have to find a way to be assertive and yet polite. And then just expect that depending on who the person is that you're talking to, the nurse or the doctor, that you might get a lot of resistance and you might actually get treated like shit because you're refusing stuff, you
Right.
know?
Or be labeled as this crazy woman, or
Yeah.
like all of that, right?
Yeah. But technically, even if they say it's hospital policy is not a law.
Yeah.
So if they say, well, it's hospital policy that you have an IV, okay, well, I am declining that and I will sign paperwork to say that. I don't want an
Right.
IV. I don't want intermittent, I don't want monitoring. I don't want whatever. Um, and there's this whole thing out there about writing your birth plan. And I think that writing the birth plan is good. It's a good exercise for women and for their partners to do so that they can have this discussion about what they do want and what they don't want
Hmm.
and understand what all is going to happen. But just be aware that like if you give that birth plan, if you print it out and you give it to the nurse, they're probably not going to read it and they don't care.
That's
They
crazy.
don't care about
Yeah.
your dumb birth plan. That's what they think is that they're dumb and they
Yeah.
see you as like because it's this God complex, right? It's this like ego. There's so much ego in Western medicine of like, we know what we're doing. You're just a dumb little woman. You don't know what to do,
Right.
especially if you're a first time mom.
Yeah.
You get
That's the
infantilized.
thing, you're a first time mom, you're scared shitless. They're telling you all this fucking jargon bullshit that you're like, what? You know? And
Yeah,
and you're right. I think the education part is a key, because if you don't know, and not only education, really tapping into yourself and how you feel. Like from what my sense is, you probably could have gone another week or two, you
oh yeah,
know, or like even a few more days because you weren't feeling jack shit, right?
right. And
But
thank God that my son was fine,
yeah,
right?
of
That he did
course,
not
yeah,
have any like he did have um physical, well, not physical, physically he was fine, emotionally, spiritually, obviously none of us were fine.
right.
And that showed up with him with all the head trauma stuff. Like he literally, me, it's like if you stroke my hair, you put me right to sleep. I could not touch my son's head for a long time
Wow.
without him, like he did not like it, you
Mhm.
know and it was like it took me a long time to put that together and
Yeah,
figure out why he did not like me touching his head
yeah.
you know You've
Yeah,
got
and it goes to show like that's the first trauma, right? Well, not only the first, but you know, like whatever the mom is, you're one unit, right? Until that baby
yes.
comes out, you're one unit. And
No,
even
even
then,
after the baby comes out,
even
this
after,
is
yeah, yeah, even after the baby comes out, but you're a unit, right? And so whatever you're feeling, if you're stressed out, if you're in a partnership that sucks, if you're, you know, like whatever you're feeling, that baby is feeling. And that's what we women don't understand. But I think we're moving back to that, like really getting
yes,
in tune, A, with yourself, and really like talking to your baby will tell you like what it needs, you know,
yes,
in utero and also outside, you know. So I think we're getting back to that, but I think we're still very, very far away, just because of, you know, the system that we're in. And that's like one of the blessings I believe COVID brought on, you know, that more
yes.
people were scared shitless to go to the hospital. So this whole birthing, we're seeing this whole birthing and homeschooling movement happening.
Yeah, revolution. It's a
Yeah.
revolution that is happening with women deciding, yeah, to stay home and really choosing to educate themselves where they might not have otherwise, like I said this before we started recording, but like I feel like that has been the hugest blessing of COVID is that when it comes to birthing babies, like it forced the hand of many women that might not have done it otherwise to actually truly consider staying home, you know? And it's like, what does that look like? Like, can I do that? Or they were just, like you said, too scared. They were too scared. Suddenly, the fear of the hospital became more than the fear that they had inherited about birth, you
Right.
know?
Yeah. And
Uh,
I believe there's a remembrance happening of
yes.
A, how powerful we are, and B, you know, like for fuck's sakes, like women have been doing this for eons. Like what, you know, what really is there to be scared of besides the programmed fear of the pain, the you know, all of this stuff. I mean, I would be more fearful of like what you said, like going to the hospital, of like all of the noises and the things and the hookups and the lines and the medicine and 15 people looking at your vagina that you don't know. Fuck that, you know?
Yeah. Yeah, and the thing is like you mentioned like true emergencies earlier, and I just want to touch on that quickly that like true emergencies are few and far between.
Yeah.
Okay? And people always ask that. They're like, "Well, what do you do if something goes wrong?" Like, because I'm a birth keeper, you know? What if you're at home and there's an emergency? Well, what if you're at home and there's an emergency and you're not pregnant? What do? You call 911, right? And then they take you to the hospital and they take care of your emergency. That's what the hospital is for.
Right.
So it's like it's almost a silly question to me because I'm like the same thing that I would do in any other emergency. I'm gonna call 911 and they're gonna come and they're gonna take us to the hospital and they're gonna treat the emergency. Like I, as a birth keeper, am not doing anything about an emergency. I don't believe that I'm God, that I can fix it or that I can save anybody. Like I'm not
Yeah.
here for that.
You're
I'm
giving
here
the
to serve.
power. Yeah, you're reminding the woman that she's the one with all the power and can do it on her own,
Yes.
or God forbid, if there's an emergency, then you go to the hospital.
Right. And like really I think because women have always birthed with with a witness, for the most part. I feel like it was a thing. You had your mom or your sisters or your
Mhm.
aunties, or if you didn't have any of that, then you had the wise woman in the village. And because there is a point in the birth process that's very common, which is called transition, you know, where this is the part where like you get you get this surge of adrenaline because the baby's about to come out. So if you have an undisturbed physiological birth, the majority of the time, early labor and even early active labor will be a very psychedelic experience. Will
Mhm.
be very like women are kind of out of it. They're like in between worlds, all the things, right? And then you get this surge of adrenaline in transition, which is almost like if anybody has ever done psychedelics, imagine if they just shut off super fast. You'd be like, "Whoa, what the fuck is happening?"
Right.
Like, and most women because they haven't ever had experiences with psychedelics and we haven't had these rites of passage growing up, um, they get scared. And that surge of adrenaline is usually when women will say stuff like, "Oh my God, something's wrong. I need to go to the hospital. Like this is wrong. Something's happening, you know?"
And what is
And it's like,
the surge of adrenaline? I mean, maybe you didn't experience it because you were drugged up or whatever. But when I hear you say that, I feel like this like heat rising, of like you become hot and like like fiery
yeah.
side. I don't.
Well,
I imagine it would be like.
the purpose of it is so that you can catch your baby. Because
Mm,
that's
okay.
what transition is. Transition means emergence is imminent. That baby's coming out. So
Okay.
now you've been in this transcendent, like whatever state you needed to be in so that you could rock through these waves and surrender to the sensations, right?
Yeah.
Now your baby's about to come out. You need to wake up so that you can catch your
Oh,
baby. So that's what
beautiful.
what the purpose of it is, right?
Yeah.
Um, and again, this is usually when women freak out and they're like, "Oh my God, I need to go to the hospital." What my role is like in that transition period when she wakes up and looks up at me and says, "Oh my God, something's wrong." I look at her, I'm like, "You're doing great." And that moment can make the difference between a traumatic and a non-traumatic birth. Because
Mm,
even if that woman is saying that, if I say to her, "You are doing great, mama. You got this."
mm-hmm,
If she's truly in transition and there truly isn't anything wrong, she'll be like, "You're right, I got this." And
mm,
she will birth her baby. Now, if there actually is something wrong and that's her intuition speaking, then me saying, "Don't worry, everything's okay, you got this," is not going to change that. She's going to
mm-hmm.
be like, "No, there's something wrong.
Yeah.
I feel like something is wrong." And that's where I always trust women.
Mm-hmm.
Right? So if
Mm-hmm.
she's saying there's something wrong, then I'm going to say, okay, this is what I see. What are you seeing? What are you feeling?
Mm,
What do you think is wrong? And it's still not an immediate, oh, something's wrong. We call the hospital.
right.
No, it might just be it needed a position change. She needs something to eat or drink or whatever. Like it doesn't automatically mean it's an emergency,
Mm,
But that's the thing is like majority of the time, when you have people that are not trained in physiological birth attending a home birth, they don't know to say that. And so
mm,
then they just say, oh, something's wrong. And they freak out because they haven't addressed their own fear about birth. And that's where you subconsciously bring your own fears about birth into that birth space.
mm,
Right. And this is where, I always recommend that women do not invite a bunch of people to your birth because now you have to manage and worry about if all of these people have done the work to undo all of that propaganda and that fear about birth.
mm,
Because that they may seem like they're fine, but that transition will make or break the birth. If those people in that room have not actually addressed their own fears about birth, that's where they can derail it super quick.
fuck.
And I've heard so many stories of this happening.
That's brilliant though. Like it just goes to show you that you really do need in that wise woman, that advisor, that level-headed person, because you obviously your hope is to have your partner, you, and hopefully that wise woman, that birth keeper, the doula, whatever, right?
Yeah.
To kind of not only ground you, but also like, hey, check your partner too, and like, hey, relax. Telling them this is this period, this period, this is what she's going through, like every period, kind of just giving more information and just be and enlightening both the partner and the mom on what's going on. And that transition period is beautiful. It just reminds me how powerful we are when we really are connected to ourselves, and like we and connected, I would imagine, to your child. You, like you said, if something is wrong, but to take that moment to pause when she is that fear, that transition period, that fear pops up, and you're like, no, 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 let's talk about this. Like, what is it? I mean, I think that's so powerful.
Yeah.
What you do is amazing.
And the
Um,
education really happens
yeah,
before then, right? Like it,
right,
like
of course.
you're
It
not
all goes out
explaining.
the fucking window when you're going through birth. I'm sure you're like, ah.
Yeah, exactly. And that's exactly what I just wanted to clarify about what you said, is that like it's a reminder. It's a reminder.
Yeah,
Remember we talked about this? That's what this is, you
right,
know? And like they sometimes people need a reminder, sometimes they don't. But yeah,
right.
for the most part, I think the thing is and you talked about the men and being able to be advocates, and I do think that that is the role of men, is to be able to be a protector and a
Yeah,
guardian of their women, right? Their women, of women. But when it comes to birth, that is the distinct difference in my mind between men and women, is that like men right now in the society that we live in as it exists are also missing rites of passage.
yeah.
Coming into their teenage years, into their adulthood, they have not been challenged to do difficult things,
Mhm.
to find that strength within themselves, because men don't have a built-in um rite of passage. That's what birth is a rite of
Right,
passage, but it's like built into our physiology, right? Men don't have that, so they need to have that from the outside, and they don't have it and haven't had it for a
a
long
very
time,
long time. Yeah,
right?
back in the
So then
day, yeah,
when they're met with the intensity of the birth process, they freak out. They're like,
yeah,
"Oh my
rightfully
God,
so. Yeah,
she's dying. Don't you hear her? She's dying." And I'm like, "Nah, bro, that's birth. Like, sounds pretty normal to me. It doesn't even sound like we're getting close yet. Like, you think that's bad? Just wait." But yeah, it's like this is what I see, is that like most men who are in the birth space, because also I heard this mentioned too, is that like men don't have the cellular memory about birth. Men being in the birth space is a fairly new concept evolutionarily, right? Like
right,
they were not in the red tent with the women when they were giving birth. It was birth is women's sphere, you
right.
know?
But they
So
were
not
the difference is, I mean, yes, they weren't in the red tent. However, they were around, like the village, back in the
yes.
day was congregated around this particular birth at the time. So they were
Yes.
there, they were doing their own like man preparations, whatever that
Right.
meant.
They had something to do,
Right,
right? In comparison to now, where most men that are in the birth space, they don't have anything to do. They're just sitting there being like, "Oh my God, this
right,
woman that I love and my child are in danger." And it's like, no, they're not. Everything's actually beautiful and fine.
right.
Um, and so again, I just want to say that I don't think that men shouldn't be there. I think men can be an amazing, amazing support person in a birth. But, before my son's father and I split, when we had talked about having another child, he had actually told me, "I don't want to be there when if you have another baby." And I was like, "Cool,
Whoa. Okay.
thank you." At first I was a little hurt, right? I was like, "What? You
Yeah.
don't wanna be there?" And then when I thought about it, I was like, "No, you know what? Thank you. Thank you for admitting that and for saying that to me, because if you don't think you can do it, I don't want you there.
Yeah.
Don't tell me that you got it when you don't got it.
Right.
Like, I don't need that energy in my space."
Because now
You
you're
know?
worried about him, and like that's the last thing you need to be worried about.
Exactly.
Yeah.
Women in the birth process, we're doing work. We got work to do. I don't
Yeah.
need to be focused on somebody else.
Yeah.
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 So
So interesting. I mean,
yeah, but education is the biggest thing I can say for that. And the thing is like I want to make it very clear that like because of rules and regulations, doulas are on the bottom of the totem pole in the United States when it comes to the hierarchy of birth in the hospital. Like
interesting. Okay.
they're pretty much a joke to everybody. Like they're only allowed to give you emotional support, physical support, like they're supposedly going to be an advocate for you, but let's call it what it is. The nurses and doctors are not going to listen to a doula. They're
Yeah,
not
because in
going
the
to.
end, it's your body, like you said, like it's your body. You're the one, the ultimate deciding factor, right? So yeah, of
Yeah.
course, it makes sense that they're not going to
And they
listen.
have, again, rules of what they can and cannot do, what they can and cannot say, and all of this stuff, which really puts them at a huge disadvantage. The crazy thing about language and all of that is that like the word doula in other parts of the world means the same thing as birth keeper actually. There
Mm,
are other countries where a doula is actually just a wise woman that comes like because they have licensed midwifery or whatever in that country, that in that country it's understood doula means you're not licensed and you're going to be at the birth, you know. Um, so yeah, so that's the other thing to note is to just understand that when I'm saying doulas are on the bottom of the totem pole, I'm speaking specifically about the United States.
right. Okay. Yeah. Because I'm sure they're revered in other countries and all of that,
Oh
and
yeah.
midwives and, birth keepers are definitely revered and listened to in other countries. We're just fucking backwards here.
Well, surprisingly though, because I had that assumption as well, right?
Oh,
Like,
really?
oh, maybe in Mexico, like they don't do as much hospital birth now. And it's like, no, they do.
They
They
do.
do.
Yeah. Yeah. I mean, let's be honest,
Birth is
everything
still
has
very
been
medicalized.
westernized at this point. It's rare to find um the like the ancestor type of thing where we have the village and the wise women and all of that. But I think it's changing. I
Yes.
have such high hopes for humanity. I believe it's changing. It's such a dystopian nightmare that we're in, but it's also so positive. And I see like the people that are actually trying to make change, and I have so much hope. I really do. I really think that we are changing this horrible paradigm that we've, let ourselves get into. And I believe, little by little, like someone like you, somebody like me, having these conversations are so important because it gives people the opportunity to know that there are other options and to not be scared,
Yeah,
not be scared,
exactly.
but more importantly, not the scared part, but to empower themselves with the knowledge and also become their own advocate and like not let shit slide. If like let's
Yeah.
say somebody still does go to the hospital or whatever, know your rights, because just because it's policy, it doesn't mean it's law. And
Yeah.
and people are just scared to stand up for themselves in those type of situations. And honestly, I mean, it's hard in those situations. You're emotional, you're hormonal, you're about to have a baby. It's hard, but it's not impossible. So
Yeah.
I
I will
appreciate this
say
conversation.
that I definitely think that when it comes to women in the birth process, that it's much better to have a partner or somebody else who's not going through the birth process to be your
Yeah.
advocate for you. Because, yeah, like I said, when you enter that third trimester, like physically, emotionally, spiritually, so much is going on. You're so open to suggestion that like that's not you cannot like some women do, right? There's exceptions to everything.
Yeah, of course.
But
Yeah.
for the majority of women, advocating for yourself while you are in the birth process is not a realistic expectation.
No, a
You
hundred
should have
percent.
somebody else.
I agree. I agree. That's why, to me, men need to be more of this conversation, or the partner, whatever dynamic of a relationship you're in, or if you're doing it on your own, hiring like a birth keeper like yourself, to be advocating for you.
Yeah.
If that's the route
There
that
are
you,
some yeah, there are some birth keepers that are willing to attend hospital births.
yeah,
So yeah, they're out there. There's everything in between, like you're saying. I have a lot of hope as well. Things are changing. There is a lot of things that are there's a lot of people that are changing their mind, that are waking up. And to speak to the fear piece, you can have your baby. You don't have to get rid of fear, right?
yeah,
It's okay to be afraid, but that doesn't mean that you can't still do it.
right.
Like, fears are going to come up, and birth, and something we haven't mentioned yet in this episode, is death, right? Like birth and death are two sides of the same coin.
Exactly.
The birth portal and the death portal are the same. And birth, personally, I feel that staying home and preserving the physiological birth process is the best way to ensure that your child is not going to die.
Right.
However, sometimes that soul's path is for them to die. and there's nothing that you can do, whether it's the hospital or anything. That was just not their path. Their path
Right.
was for them to die, you know.
Yeah.
And that's okay, because the thing is, when it comes to babies dying, that's a whole nother even thing that we could talk about, of like how they're treated in the hospital
Oh God, I just
versus, you know, how that death can actually be sacred and revered in the comfort of your own home,
yeah.
you know.
Yeah, what babies go through, from what I've seen and heard at the hospital, like immediately being taken away, immediately like shoving shit in their noses and drops in their eyes and all of the stuff. It's just like, what the fuck are you doing? And then not only that, like, cutting the placenta, and
Yeah,
like
cutting
where
the
the,
cord.
yeah, cutting the cord, or sorry, yeah, the cutting the cord where it can actually, it's like, leave it there because it feeds the baby for another, like, what, 3 days or something, I don't even know. But just what they do to babies, I mean, talk about the trauma, that most of society, because at this point, like, if you're anybody like my age or younger, most people have gone through the birthing process in a hospital.
Yep, I was
And
born in the hospital.
yeah, so there you go, it starts there, of like how the trauma
Yeah.
word trauma because it's just so overused now, but it's true.
Yeah, I mean, sometimes it is just the best word. But yeah, I
Yeah.
want to just speak real quickly about the placenta, because that's the other thing that does not get talked about a lot. And it's
Oh
very
yeah.
important, you know, like birth is not over until the placenta comes out. And when you're in the hospital, again, everything is on their timeline and they're in a hurry. So they're going to pull it out. And then when you pull it out and it's not ready to be released, then it's like you get women hemorrhaging and they're like, oh, yeah, we don't know what happened. And it's like, no, majority of things that go wrong in the hospital were caused by things that the
Oh
hospital
yeah,
did.
I mean, let's talk about that. The hospitals just are, like, doctors are the third leading cause of death.
Yeah.
The third. Let me just put this to those listening very clearly. They are the third leading cause of death. Hospitals, just in general, doctors. So that's
Yeah.
fucking crazy.
Yeah.
Yeah, no, thank you. You know,
Yeah.
so
Definitely not. But yeah, when you are having your birth at home, you know, like the placenta and cutting the cord, that's the other thing, is like, I don't agree with this term called delayed cord clamping, because it's like it's very confusing. But
but why would you
basically,
even
like,
want to clamp a thing that's like a org, or like, to me it
because they
seems
want the
like a,
blood. They want the blood and they want the cells.
yeah, they're
Those,
doing stuff with it, right? I've
yes,
heard
if you
fucking
go into the
crazy
hospital,
stories about that. We
this is
won't
the
even.
only thing that I am so grateful that I did, was before anything got crazy at the hospital, I signed the paperwork and made sure that I was going to keep my placenta. Now,
And they fight you on that, right?
oh yeah, like
Big
they're not going
time.
to tell you that you have the option to keep it. And, you know, mind you, it is still an organ. Like, it's like raw
Right.
meat,
That's
right?
what I
Like, you
thought.
need to
Yeah.
be prepared to take it home. I had a bag with a cooler and all of that to take it home. And I actually had it processed and I did the encapsulation.
The
But
pills. Mhm.
yeah, or you could just stick it in a freezer bag and put it in your freezer and then bury it somewhere. A lot of women like to bury it under a tree that they like plant, you know, at their home, and they have that tree grow with their child and be fed
Beautiful.
by the placenta. There's so many
Yeah.
beautiful things you could do, right? You could
Yeah.
do lotus birth. You don't even have to actually cut the cord at all. You could just let it naturally fall off.
Die. Yeah.
Um, but yeah, no, the hospital that's gonna take that placenta unless you are very, very intentional about making sure that they don't. And they're gonna try to tell you again, oh, it's hospital policy that blah blah blah. Oh, if this or this or this happened in your birth that they usually cause, we have to be able to look at that placenta and to try to like figure out what happened.
Mm-mm,
No, they don't.
motherfuckers. They're doing some shit with that. I'm
They
telling
make
you. Freaking me out.
buku bucks on each of those placentas. Yeah.
What do you think they do with them? What do they sell them? Who do they sell them to?
Oh, they
Going
use it for all
total
of these.
conspiracy theories.
Yeah, well, I mean, if you think about even cord blood banking, that was something that we had looked into. And when I realized, basically, the thing that made me decide against it was that it says in the contract, if your child doesn't actually end up using this cord blood that we froze for them,
Mm-hmm.
it's our property. So the company keeps the blood. They don't give it back to you.
Yeah, I do not trust that at all. Can you see me? Hold on.
There we
Okay,
go.
there we go. Yeah.
Sorry. What was the last thing you heard me say?
No, that they keep the blood and all of that. Yeah, I don't know. I just think that it's, my conspiratorial mind goes to all kinds of weird places, and like I do not trust them or would want them to take the baby into any other room. Like, no,
Yeah, babies
but
should be with their mothers because, like you mentioned earlier, I want to circle it back to that. The mother and baby are a dyad. That
yeah,
means that they are two parts of one entity, one being, right? Like, and that doesn't happen, that doesn't stop when you cut the cord, when the cord falls off, whatever it is. Like, that mother and baby are one. They should never be separated. And
yeah,
this goes into even postpartum when you go home and people come over and they're like, I want to hold the baby. No, don't touch that freaking baby unless that mother specifically hands you the baby and says, hold this child while I go pee. And guess what? You can hold your tiny newborn baby while you go pee. I did it.
right.
Like
Of
they're not
course.
that heavy.
So for how long? Like,
Honestly, I, at least for the first 40 days, at
okay.
least, I would think, for me, if I was gonna, like, if I am blessed to have another child, that baby is not getting passed around until they're crawling.
Wow.
They
Okay.
can move away from me on their own. Mind you, like I think I'll probably feel into it, of course,
Yeah.
because of course I want my mom to hold the baby and all of
Yeah,
this
yeah,
stuff,
yeah.
right?
I
I'm
think
not saying
the
that there's
woman,
anything
yeah. I
wrong with
think
that.
the woman will feel, each woman will have a different intuitive knowing of when she's ready to like pass the baby around.
Yeah. I'm just
But definitely
saying,
not
I'm
like the
just speaking
first
to the
week.
culture. No, yeah. And I'm just speaking to the culture of like coming over to a postpartum mother
Yeah.
and
Just
and
send food,
expecting.
people. Just send food. That's the
Exactly.
best
Don't ever
thing.
come over empty-handed,
Yeah.
right? And don't come over expecting her to hand you the baby. That's not what you're there for.
Yeah.
Postpartum women deserve to be catered to hand and
Exactly.
foot, and they should have their baby on them, like as much as they want. If they feel comfortable handing that baby over, cool. But most of the time, women, again, it's this from the media, from their culture, whatever, they're like, oh, no, I have to. No, you don't.
Yeah.
No, you don't.
And that's what I'm saying.
Like,
Women will, each one will be individually different and will
yes.
intuitively feel like when they're ready to like, have people over and all of that. But my recommendation is if you do have a mama who just gave birth, send food because they don't have
Yes.
time to fucking cook. The dad's not cooking, mostly too. And and hopefully the partner is around and also they're bonding with the baby too, because that's really
Yeah.
important.
Oh, yeah.
Husband, partner, whatever dynamic it is, whoever is going to be the role that like the parenting role in that baby's life should be that little pod, right?
Yeah.
Just
Yeah.
that
Because,
little
like you
pod.
mentioned, your friend and her adult daughter that still lives with her, it's like if her daughter had a baby, then that mother is in that home. Like, that's
Yeah,
part of
it's the
that little
pod. Yeah,
pod.
yeah,
Yeah. Yeah.
yeah.
Yeah. I'm not saying that you can't let people hold your
Of
baby, to
course,
be
yeah.
clear. I'm just saying you don't have to. And to understand, right? There should be the understanding that that mother and baby are one. Like there shouldn't be extended periods of time where that mother and baby are separated. The fact that I went back to work at 3 months after my son was born is like horrific to me now.
Well, that's a whole nother podcast in and of
Yeah.
itself. I mean, like
There's
we can
so
go
many of
on.
these things.
Yeah,
Yeah,
we
we
can
could
go
talk about
on
this
and on.
forever.
We can go. And another thing that I wanted to touch on, but we'll make another effort to get into this as well, is just how because I we kind of talked about like having the discussion, but I think we're getting into the 2 hour mark, so I don't want to take up too much of your time. but how this whole cultural thing of this trans movement, you know, and I have zero issues with trans people or any of that, but how again, here we are, we women being gaslit by men who
Right.
are thinking that they're, you know, that are thinking that they're women. It's a whole another podcast in and of itself, but it's something that I want to have a conversation about, and it'd be interesting to have your take as a birth keeper on what your thoughts on those things are. But again, like we can have that conversation another time because I know that
Yeah.
would be a
Well, I
whole
mean,
topic.
the one thing I'll say right now is that, like, you know, we talked about education being the big thing as far as men being able to advocate, right? But the education for women about our own bodies is also severely lacking.
Yeah.
Like, I only learned in the last 3 years the difference between the male and female pelvis, right? Like, I didn't ever actually learn this, not even in nursing school.
Mm-hmm.
Just gonna say that. Like, majority of Western medicine is based off of the male body, and they just assume that women are
Yeah.
men. We're not, right? You can actually tell a female skeleton and a male skeleton apart if you look at the pelvis and all other, you know, markers. And so the female pelvis not only is shaped differently, but it moves differently.
Mm-hmm.
And this is where this fallacy of your pelvis is too small to birth your baby is a joke, because the pelvis expands and moves to support the exit of that baby.
Mm-hmm.
You know what I mean? And when you have a truly physiological birth, that's also what prevents and what protects against shoulder dystocia and all these other fears that, like, they bring up about birth. It's like, if you let women intuitively move their body, if you let that baby be born in whatever position it's in, because a lot of times that position is very wise. If a baby is breached, there's a reason. If a baby is sunny side up, there's a reason. You know what I mean? Like, babies are intelligent and they are participating in their birth. It's not just, you know, like a one-sided thing. And so, um, like I mentioned cervical orgasm in the beginning. Most women are not even taught about what a cervical orgasm is. Most women don't know that their clitoris is bigger than just this little pea-sized
Right.
protrusion at the top of
Yeah, it
their
goes.
vulva. You know, it's a big structure on the inside of our vulva. And
Yeah.
it's like the flight of the cervix in orgasm, we don't learn about that, you
Yeah.
know? So
Or
it's like,
let alone our periods, how to like prevent ourselves from getting pregnant just based on our cycles of our period and our temperature. There's only really like one or two windows where we can get pregnant. Why isn't this being taught? No, instead, we get on fucking birth control pills that drive us crazy, make us insane,
yeah.
or like make us break out, make us gain weight, uh, picking the wrong partners because of the hormones. God,
I was on birth control
yeah,
when I
picking the
met my
wrong partners
my
because
partner.
yeah, we're not intuitively knowing like what's going on with the basics that each and every female gets is just the period, you know, like this is a monthly like thing that we should know about, you know, and I didn't know this shit until like 5 years ago. I'm like, oh, can track, you know, my cycle and blah, blah, blah. And now, of course, it's easier because you have apps and stuff like that, you know, so you put down when you get your period, when, and it shows you like when you're ovulating, when you're able to get pregnant and blah, 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 blah.
I mean,
Uh,
yeah, but those apps, oh, I just would caution against trusting the app. Like, the app is
sure.
good to, I use an app, right? I use
Yeah,
it as a method
I do
of
too.
helping me easily keep track of my symptom, well, not
Yeah,
symptoms, like my cervical mucus and all of that stuff,
yeah,
right? And then I transfer it onto paper because, you know, conspiracy, I don't trust whatever.
sure.
But yeah, definitely do not be relying on an app to tell you when you're ovulating, because the tech behind that and like what they use to determine that is not always right. I highly recommend
I agree.
learning, yeah, learning fam, actually understanding for yourself how to determine that. You know, like, it's definitely better for record keeping, at least as far as the app goes. But
Yeah,
yeah,
and that's what I use it for, is for record keeping, and then also, you know, checking. I mean, I'm not sexually active right now, so whatever. But
yeah,
but it's checking my temperature along with it, and noticing when I have more of that vaginal discharge, and both, so I know. And also another thing that I've gotten into is fasting during like a certain particular cycle too, which really helps women in terms of like getting control of their hormones, and also b having that fat burning mechanism kick in, with so many things that we just are not taught about,
Yeah.
and like the simple basic of our period, tracking our period. Like,
Yeah.
we know that. We used to know that. Women used to know this, and we just, you know,
Yeah, it's one of the many things that's been lost. Yeah. So
yeah,
education, 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 right? Is like, I feel like the biggest theme about this.
yeah,
Learning what physiological birth actually looks like, learning about your body, learning about your cycle. I'll just touch on really quickly that infertility is a big deal right now. A lot of people are
well, yeah,
infertile. And I
hmm,
think that that IVF is not the answer,
no,
right? Like the answer is actually learning about your cycle, because our cycle is a very big indicator about our overall health as women. And if
yeah,
you are understanding your cycle and you're paying attention to it, and you're, working with your cycle, and, all of these things, like I know a woman who was quote unquote infertile for 7 years, and she just birthed her second baby,
yeah,
by doing this, by learning FAM, by learning about her body, by changing her lifestyle in certain ways,
hmm,
she cured herself of
yeah,
her quote unquote infertility. And because again, IVF is drugs, money, 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 so much money to be made off of that, and women's bodies being exploited. Oh, yeah, that's a whole other podcast in itself. But yeah,
yeah,
learn
yeah.
about your body, learn about your cycle, learn
Absolutely.
about birth.
I believe that honestly, the human being, the capacity, I mean, we are just, I believe we're the most miraculous, and I don't want to say machine because that's like even degrading, but like we are the most,
Organism.
yeah, we're self-healing, like we can do so many things if we actually just tapped in and like realize what the body needs. And we're evolving, of course, as the planet changes, as the frequencies change, uh
Yeah.
we are evolving as well. And I believe that we are just such a miraculous machine. We like they want to do AI and all this bullshit, and I think we're the best AI there is. And
Yeah, you can't copy it.
you can't, and no AI is ever going to be as powerful as we are. I mean, I'm sorry,
Yeah.
there's no way. So again, I even though it seems dire and that like things are bad, I actually believe the opposite. I think that things are changing for the better. We're getting more in touch with ourselves. We're getting more in touch with community. We're realizing that we can't function the way that we've been functioning, and something's got to give. So, and birthing is a big part of it. So I
Yeah.
appreciate what you do. And
Thank you.
tell us where people can get a hold of you. And obviously I will put everything in the notes and stuff like that. But you mentioned something of a free guide. I'd love people to know about that,
Yeah.
all of that. So
So I'm most active on Instagram. My Instagram name is, it's in Spanish, La Comadre Luna. Um,
I love
so
it.
so yeah, she'll have that in the show notes. I'm not gonna spell it out. And then my website is the same, lacomadreluna.com. I think I also have .net as well. And yeah, that's the best way to reach me, is to follow me on Instagram, or reach out via my website. I do, right now, because my situation has changed with my son, I'm not actively attending births in person.
Mm-hmm.
But I am available for virtual support, especially for people either who don't like who's in their area, or who are in these rural areas where there aren't any birth keepers. They can definitely reach me, and I'm available to support them virtually for that.
I
Um,
love that because, obviously not everybody you're from here, from California. And, most of the listeners here are, I do have some around, but most everybody is in, California. And it's great that you do virtual support, because I think people, I mean, a lot of the times you can't find somebody you resonate with, and of course not everybody's going to resonate with you, but it is what
Yeah.
it is. Your people will find you. And yeah, I love that you're doing it virtually as well.
Thank you. Yeah. And then in addition to that, I also do birth trauma debriefs. So for women that have actually identified their birth as traumatic, and it doesn't have to just be your birth. It can be your prenatal, during your pregnancy. It can be your immediate postpartum. Like I've done sessions with women who had an amazing birth and then it got sabotaged right after, you know. So I've done debriefs for that, sessions around, yeah, I mostly do birth, but other nurses that have left that want to talk about that, navigating the world after
Yeah.
Western medicine,
And I mean, it's happening a lot,
Yeah,
and
there's been
doctors, yeah.
a huge shift of people leaving. Yeah. It's like we were already in a nursing shortage before. I don't know how people are functioning now in hospitals. It's
You know
crazy.
what? I personally, I like that things are starting to head more towards the private, and I think that this is where we're headed, because personally, if I want to get anything, I pay out of pocket. Like anything that I want, like a checkup, blah, 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 I pay out of pocket. Like I'm not gonna go to these primary care doctors that just don't care. They're like, look, you wait like an hour for them to see you for 5 minutes. They don't even no, thank you. So I like where all of this is headed, and I like that you're doing, your birth keeping separate from, like the doulas and midwifery and all of that. So you're a gift to the women out there.
Thank
And I
you.
am so grateful that we had this conversation. I mean, we can talk about so much more
I know, right?
for episode 2, episode 2,
Yeah.
we'll do another one, but
Tried so hard to like stay on topic, but man, everything is just so interconnected. It's so
yeah,
hard.
everything's connected. It's hard not to, it's everything, like literally everything is connected. So it's hard to stay on one thing and not veer off subject. But this has been a extremely illuminating conversation. I'm so grateful and happy to have you on, and I appreciate your time. And we'll do it again.
Awesome. Thank you so much,
Thank
Gabriella.
you. Have a great the rest of your day.
You too.
Okay, bye.
Bye.